Tayside NHS Board, British Sign Language Local Plan 2018 to 2024. A review of this plan will take place in 2020. Section 1. Contents. Section 2. 2.1. Introduction. Section 3. 3.1. Way forward in developing NHS Tayside BSL local plan. 3.2. What we have done so far. Section 4. Draft BSL local plan. 4.1. Across all our services. 4.2. Family support, early learning and childcare. 4.3. Training, work and social security. 4.4. Health, including social care, mental health and wellbeing. 4.5. Transport. We want to make Scotland the best place in the world for BSL users to live, learn, work and visit. Section 2. 2.1 Introduction. NHS Tayside is committed to the delivery of this local BSL plan. We will work in partnership with our 3 local health and social care partnerships, HSCPs, in Angus, Dundee and Perth and Kinross, to deliver the actions identified in the plan. We will also work collaboratively with other local partners and third sector organisations. NHS Tayside will involve, engage and consult with BSL users and the deaf community in the delivery of the plan and work collaboratively to meet the outcomes of the BSL National Action Plan. Section 3. 3.1. Way forward in developing NHS Tayside BSL local plan. Responsibility for development of the NHS local BSL plan sits with Head of Corporate Equalities, Corporate Services, Chief Executive's Department. We will be working in partnership with the 3 local authorities and the 3 HSCPs in Angus, Dundee and Perth and Kinross to involve, consult and engage with deaf and deafblind users and other key stakeholders in delivery of the actions and monitoring our progress. NHS Tayside will report on progress with its actions to share in the National Progress Report in 2020. The plan will be published in BSL on NHS Tayside Internet for consultation and people can comment on the draft until October 2018. Information on consultation can be found under Section 5, What Happens Next. The lead officer is Santosh Chima, Head of Corporate Equalities, Chief Executive's Department. (3.2) What we have done so far. Local authority partners and NHS Tayside met with members of the deaf community and other key stakeholders for a planning and information sharing event on developing local plans on 27th of April 2018. The event allowed a sharing of information on the legislation, development of the local plans, and involvement in how we engage and consult with local deaf and deafblind communities and other key stakeholders. Two local events took place, one in Perth and Kinross on the 11th of June 2018 and one in Dundee on the 30th of May 2018. The Dundee event was jointly led by Dundee and Angus Local Authority. NHS Tayside was represented by Corporate Equalities team members. A final event took place in Dundee on the 27th of June 2018, which brought together all participants and feedback from the two local events. This allowed for partners to include the outcomes from these events into their draft plans and to consult with deaf and deafblind community for feedback and comment. NHS Tayside has already engaged and consulted with the deaf community and their carers and relatives around the new NHS in-house interpretation and translation service. Dundee HSCP was involved with this event, which was facilitated by Dundee Voluntary Action. The outcomes, feedback from the March event were written up and have been used in developing this plan. NHS Tayside has employed its own sign language interpreters who have supported the development of the plan and will also support publication in BSL. The plan will be approved through the governance processes in place for equality and diversity. NHS Tayside is also developing its own internal timeline to allow consideration of all of this to be able to submit the final plan for approval to the board, which has to be published by 24th of October 2018. The first cohort of staff have just completed BSL Level 1 and we already have staff waiting to start the next training session. The training is run over a 14-week period with a 2.5-hour session every week. NHS Tayside Interpretation and Translation Service Information and Management System now holds data on all BSL requests for patients who have required a sign language interpreter to access NHS, including primary care and independent contractors, and HSCP services. We are able to pull off reports on usage and number of deaf patients accessing our services. We are developing the system to give us more detailed reporting. NHS Tayside are working with Contact Scotland BSL to help deliver awareness sessions on how to access and use this service for both staff and the deaf community. HSCP in Dundee are running a short training session for receptionist staff, including reception staff in GP services, on the 28th of August 2018 to ensure that deaf patients get the right service at the right time. This is also open to NHS Tayside staff to attend. NHS Tayside in-house employed sign language interpreters are working with the communication team to ensure information is accessible in BSL to the deaf community. These BSL videos will be posted on the NHS Tayside website for information. NHS Tayside StaffNet also has some very basic BSL signs which all our staff can access and learn to help support basic communication. NHS Tayside Interpretation Service has taken on board feedback and comments from the deaf community on how to improve and develop the service. This is a continuous improvement piece of work. We are also doing improvement work with the complaints team and the complaints process to make the complaints procedure more accessible to deaf BSL users. Encouraging deaf BSL users to text I&T service to check if an interpreter has been booked for their appointment. I&T team assesses each individual BSL booking request with regards to the nature of the appointment and availability of male or female interpreters. Section 4. BSL Local Plan for NHS Tayside Board. 4.1. Across all our services. We share the long-term goal for all Scottish public services set out in the BSL National Plan, which is: across the Scottish public sector, information and services will be accessible to BSL users. 4.2 Family Support, Early Learning and Childcare. We share the long-term goal for family support, early learning and childcare set out in the BSL National Plan, which is the Getting It Right for Every Child, or GIRFIC, approach will be fully embedded, with a deaf or deafblind child and their family offered the right information and support at the right time to engage with BSL. Our actions. By 2024, we will. We have investigated this, and there are already places in Dundee that run baby signing classes. We will investigate further with our local authority partners and health and social care partnerships across Tayside to see how we can work with parents and babies to access these classes. Work with our health visitors to see how we can support deaf parents of toddlers and children who are hearing. Engage with the local authorities to look at support for nurseries and baby toddler groups. (4.3) Training, work and social security. We share the long-term goal for training, work and social security set out in the BSL National Plan, which is BSL users will be supported to develop the skills they need to become valued members of the Scottish workforce, so that they can fulfil their potential and improve Scotland's economic performance. They will be provided with support to enable them to progress in their chosen career. Our actions. By 2024, we will work with NHS Tayside Employability Service to progress this action. (4.4) Health, including social care, mental health and wellbeing. We share the long-term goal for health, including social care, mental health and wellbeing set out in the BSL National Plan, which is BSL users will have access to the information and services they need to live active, healthy lives and to make informed choices at every stage of their lives. Our actions. By 2024, we will carry out further promotional and awareness work in partnership with health and social care partnerships for both staff and the deaf community on Scottish mental health service for deaf people. This service is a nationally supported service for all 14 boards, which is hosted in NHS Lothian. The service provides a high-quality service for deaf people suffering from a mental disorder. (4.5) Transport. We share the long-term goal for transport set out in the BSL National Plan, which is BSL users will have safe, fair and inclusive access to public transport and the systems that support all transport use in Scotland. Our actions. By 2024, we will Address this in partnership with local authority partners and NHS Tayside transport team. Section 5. What happens next? If you would like to comment on this draft, please contact NHS Interpretation and Translation Service by text mobile 07967776628, email shonaricchie@nhs.net, or telephone 01382 596 954. British Sign Language users can contact us via Contact Scotland BSL. Final version of the plan will be published by 24th of October 2018 in English and BSL.